Hello students. Today we'll discuss about the anatomy of femoral nerve. Now as you know that there is a presence of femoral triangle on the front of thigh, and when we are talking about the femoral triangle you will have the three structures: femoral artery, vein and nerve. So in today's lecture we will see the femoral nerve, and as you know that the front of thigh is known as the extensor compartment. So we will see the nerve supply of the muscles of the front of thigh and what are the areas of the distribution of the femoral nerve in detail. So let's start with the femoral nerve. So whenever you are having the femoral nerve, you always first keep this thing in mind that this is a nerve of the anterior compartment. And my dear students, the anterior compartment is known as extensor compartment of thigh. So when you are talking about the compartments of the thigh, there are three compartments in the thigh. So there is a femur in the center. Now this is your outer part of the thigh. Now this is divided into the three compartments. You will have anterior compartment, you will have the medial compartment, and then you will have the posterior compartment. Now when you will have the anterior compartment, we are having the nerve which we are discussing today is femoral nerve. When you are talking about the medial compartment, you will have the nerve is known as obturator nerve, and when you will have the posterior compartment, you will have the different branches of sciatic nerve. So in this anterior compartment, you are having a nerve predominantly, and that is your femoral nerve. Now when we are talking about the origin of this nerve or the beginning of the femoral nerve, the beginning starts from the lumbar plexus. So when we are talking about the lumbar plexus, it is very important to understand that lumbar plexus is formed in the lumbar region. Here you can see that this is your vertebral column, and in the lumbar areas you are having the plexus on both the sides, which is known as lumbar plexus. Now there are some important facts about the lumbar plexus that I will like to discuss here only, that when we are talking about the origin of femoral nerve, you have to understand that lumbar plexus are having four basic nerve roots, or I should say the basic roots of the lumbar plexus. What these basic roots of the lumbar plexus? You will have the L1, L2, L3, L4. These are the four parts, or you can say the formation of lumbar plexus by the four roots. Now today we will not discuss the L1. Now when you will have the remaining three, L2, L3, L4, what will happen that every part of the L2, L3, L4 divide into the anterior and posterior division. So this is your L2, it will divide into the anterior and posterior. This is L3, it is divided into the anterior and posterior. This is L4, which is divided into the anterior and posterior. Now what will happen next is that the part of the posterior division of L2, L3 form the lateral femoral cutaneous nerve, or it is also known as lateral cutaneous nerve of thigh. So what are that? It is your L2 and L3. That means this is L2, this is L3, but which division? Posterior division. So here you can see that this is the posterior division. So I am using the red color for this. Now this posterior division of L2 and posterior division of L3 join, and it will form, this will form lateral cutaneous nerve of thigh or lateral femoral cutaneous nerve. Now the other portion of the posterior division of L2, L3 nerve and all the posterior division of L4. That means what will happen that this posterior division is also having the one more component. So how this? Now this is the posterior division of L2, this is the posterior division of L3 and the complete posterior division of L4. Now they will join, and this is known as femoral nerve. Clear? So now the question comes is that posterior division of L2 and posterior division of L3 give rise to the two nerves. One is lateral cutaneous nerve of thigh or lateral femoral cutaneous nerve, and second is the part of femoral nerve. Femoral nerve is coming from the three areas: posterior division of L2, posterior division of L3 and complete posterior division of L4. That means the posterior division of L4 is solely contributing in the femoral nerve, while the posterior division of L2 and L3 are contributing in two nerves. One is the lateral femoral cutaneous nerve and second is femoral nerve. Now what happened with these three anterior divisions of L2, L3, L4? So the anterior divisions of L2, L3, L4 form the obturator nerve. So if you will join all these three nerves, if you will join this with this and this, so all these three will join and they are forming a common nerve, and this is your obturator nerve. Clear? So here what you are able to understand, that obturator nerve is coming from L2, L3, L4 and femoral nerve is also coming from L2, L3, L4. What is the difference? The difference is that all the three anterior divisions form the obturator nerve and the dorsal divisions of L2, L3, L4 form the femoral nerve. So this is a very commonly asked question, that the root value of obturator nerve and root value of femoral nerve both are same, L2, L3, L4. But there is a division, one is anterior division for obturator nerve and posterior divisions for femoral nerve. So my dear students, the largest branch of the lumbar plexus is known as femoral nerve, and it arises from the posterior divisions, or you can say the dorsal divisions of the ventral primary rami of L2, L3, L4. Clear? So what is root value? L2, L3, L4. Now when you will see the origin of femoral nerve, it is not at all visible. Why it is not visible? Because, my dear students, you have to understand that the formation of the femoral nerve is within a muscle, and that muscle actually surrounds the exit through the intervertebral foramina of lumbar region, and that muscle is known as psoas major. What is that muscle? Psoas major. So this is again a question of your exam, that which nerve plexus are present in the substances of the psoas major muscles. Answer is lumbar plexus, and that's why the origin of the nerves from the lumbar plexus are not visible, and it looks like that the nerves are coming out from your psoas major. So let's see in this diagram here. Now here what you are able to understand, that this is your psoas major muscle. You can see this psoas major. Now this psoas major is having the attachment here on the side of your vertebral column in the lumbar region. Now here you can see that nerves are coming out from the psoas. So it looks like that they are coming, or they are piercing the muscle. But when you will remove the psoas major, when you will dissect the psoas major, you are able to understand that it is not like that. So let's see this video clip. If I will remove this psoas major, you can see that nerves are present deep inside the muscle. And here, these all are nothing but these are the different branches of your lumbar plexus. Now, as today we are talking about the femoral nerve, so here you can see that this is your femoral nerve. Now, this femoral nerve here, you can appreciate that it is coming out from the lower part of your psoas major along the lateral border. So along the lateral border, we can see that this nerve is coming out and this nerve is femoral nerve. Now, I told you that there are two nerves which are having the common root value L2, L3, L4. One is femoral, second is obturator. Now, when you will see the exit from the psoas major, you will realize that this is your femoral nerve. And this femoral nerve, if you will draw the psoas major here, what you are able to understand, that this is the psoas major. So the femoral nerve is remain lateral on the psoas major, and obturator nerve remain on the medial side of the psoas major. So this is a very important thing to always identify in the dissection. If you are trying to see the obturator nerve, then you have to go on the medial side of your psoas major muscle. And if you want to see the femoral nerve, then you have to come on the lateral side of psoas major. Clear? So this is your obturator nerve, and this is your femoral nerve. So whenever you are trying to identify the femoral nerve and obturator nerve, and their exit from the psoas major, you have to look lateral to the psoas major for the femoral nerve and medial to the psoas major for the obturator nerve. So now what is the course and relation of the femoral nerve? So as I already told you that it arises from the psoas major. So first we will see the course in the lower part of the abdomen and then it enters into the thigh. So we will see the course in the thigh also. So let's discuss first its course in the abdomen. So it begins on the posterior abdominal wall, but obviously why posterior? Because it is coming from the lumbar plexus and then it is coming out from the lateral border of psoas major, which is a muscle of the posterior wall of abdomen. Now the femoral nerve emerges out through the substance of psoas major. So I think now it is clear that why we are using the word emerge out from the substance. Why emerge out from the substance? Because the formation of the femoral nerve is inside the psoas major. And why inside the psoas major? Because you are having the lumbar plexus and the exit of the branches of lumbar plexus all are first surrounded by the muscle fibers of the psoas major. So once the nerve will emerge out from the psoas major, you have the another question, which part of the psoas major? So answer is lower lateral part. Clear? So it emerges out from the lateral border of the psoas major, but upper or lower, so it emerges from the lower lateral part of the psoas major. Now then it descends over the surface of iliacus muscle. Now this is again important part to understand. And there is one more thing is that when it is running on the iliacus, it is lies deep to the fascia iliaca, or it is covered by, or it is under cover of fascia iliaca. So here, what is happening here? Now here you can see that this is your formation of femoral nerve, and this femoral nerve will come out from the lower lateral border of the psoas, and once it will come out, here you can see that it is running on this muscle, and this muscle is your iliacus. Now my dear students, this iliacus muscle is further covered by a fascia, and that fascia is known as fascia iliaca. But here the important thing is that this nerve lies between the fascia iliaca and the muscle. What is the meaning of that? Suppose this is the muscle of my right iliac fossa, this is iliacus. Now the nerve is on the muscle, and then on the muscle you will have one more layer, this is your fascia iliaca. So here the nerve is become sandwich. Now there is a sandwich type arrangement. Now one layer of the sandwich is formed by the muscle itself, another layer is formed by fascia iliaca, and nerve is between both the layers. Clear? Now there can be the one more probability that suppose this is the iliacus. Now iliacus is covered by its fascia and then the nerve lies outside. Clear? Now if the possibility can be there, but what is the reality? Reality is that the nerve lies between the fascia iliaca and iliacus muscle. Now this is an important concept to understand, because when you will go into the front of thigh, when you will see the femoral triangle, you will have the relation that the femoral nerve is not a contained of femoral sheath. Why? Because the femoral sheath posterior wall is formed by the continuation of fascia iliaca and anterior wall comes from fascia transversalis. So whatever the structures which lies anterior to the fascia iliaca become the contained of your femoral sheath. But the nerve is not lies in front of the fascia, it is outside the fascia. So the nerve will go outside the femoral sheath. Clear? So if somebody will ask you why femoral nerve is not a contained of femoral sheath, your answer should be very clear that this femoral nerve lies under cover of fascia iliaca. That means it lies between the iliacus muscle and fascia iliaca. It is not above the fascia. If it is above the fascia, then it becomes part of femoral sheath. Clear? So it is related to the femoral artery, but obviously, and continuously the femoral nerve descends and the femoral nerve lies between the psoas and iliacus. Now this is again the important thing. When you will see the front of thigh, you are having a groove between the iliacus muscle and the psoas major, and that groove lodges the femoral nerve. Clear? So, what is the course in the abdomen? In the abdomen, the formation is there. In the abdomen, it emerges out from the lower lateral border of your muscle is known as psoas major. Then once it will come out, it will run between the fascia of iliacus and the muscle itself. Clear? It is not superficial to the fascia, but it lies between the fascia and the iliacus muscle. And then it enters into the front of thigh. Now what will happen in the thigh? It enters in the femoral triangle by passing behind the inguinal ligament, just lateral to femoral artery. Now that we already know that when you are having the inguinal ligament, which is extending from anterior superior iliac spine to your pubic tubercle, now there is a gap behind this inguinal ligament. And through that gap, the contents are entering from abdomen to the thigh. So here in this image, what you are able to understand that this is the one muscle which is going into the thigh. This is the another muscle which is going into the thigh. So what is this muscle? This is iliacus. This is psoas major. Clear? Now between the iliacus and psoas major, here you can see a thick nerve. Now this thick nerve is nothing but it is your femoral nerve. So now the question comes is that what structure lies in between the groove of iliacus and psoas major? Answer is femoral nerve. Clear? Now next to this psoas major muscle, here you can see this is your artery, then you will have vein. So what are the structures or what is the relation of the structures in the front of thigh? If you will see the relation from medial to lateral, it is vein, V-A-N. What is that? Vein. V-A-N. Femoral vein, artery and nerve. But the difference is there that these both structures are enclosed into a femoral sheath. But this nerve is not the part of femoral sheath. Clear? So here it is very clear to us that this nerve ultimately enters into the front of thigh by passing behind the inguinal ligament. Clear? Now it lies outside the femoral sheath. I just explain you because the femoral nerve lies posterior to the fascia iliaca. Now about 2.5 centimeter below the inguinal ligament, femoral nerve divides. So when you will see the femoral nerve in the front of thigh, you have to understand that femoral nerve is not a long nerve. It is having a very short course in the thigh, and as soon as it enters into the thigh, it is hardly 2 to 2.5 centimeter long only, and its trunk immediately divide into the anterior and posterior division. Clear? Or it is also known as superficial division and deep division. So when you will see the femoral nerve in front of thigh, you have to understand this thing that femoral nerve divides into the two parts, superficial and deep divisions. Now lateral circumflex femoral artery, it is a very important landmark. It is very important question for your exam that how to identify superficial and deep division, and the answer is by the presence of lateral circumflex femoral artery. So lateral circumflex femoral artery is a branch of your deep femoral or profunda femoris artery, and this artery is a very important landmark. The nerves which is anterior to the artery are the branches of anterior division, and nerves those are behind the lateral circumflex are the branches of deep division. So now we will see the branches of femoral artery. So first in the abdomen. So in the abdomen, it is generally give two muscular branch. One branch is to supply the iliacus muscle. So the one branch which is supplying the iliacus arises very early from the femoral nerve. So the femoral nerve send a motor branch to the iliacus before it going deep to the inguinal ligament, and there is a one more branch that is nerve to pectineus. Now my dear students, this nerve to pectineus is having some different origins. Why I am saying this? Because some author says that the nerve to pectineus, now suppose this is your inguinal ligament. So nerve to pectineus arises in the abdomen above the inguinal ligament. Then it will go deep to the inguinal ligament to supply the pectineus. Some book says that this nerve to pectineus may arise in the upper part of front of thigh to supply the pectineus. So this is the variable origin, but the nerve to iliacus always arises in the abdomen, and most of the time the nerve to pectineus also arises just above the inguinal ligament, but for supplying to the pectineus it has to come in the front of thigh. Clear? So once the nerve enter into the front of thigh, I already told you, divide into the anterior and posterior division. Now when you will see the anterior division will give two sets of the branches to the muscle and branches to the skin. Now it will supply only one muscle, and that is known as sartorius. You know that sartorius is a very long muscle of the front of thigh, and it is supplied by the branch of the anterior division of femoral nerve. Sometimes, as I already told you, the anterior division may supply the pectineus. So the pectineus, nerve to pectineus, may arises in the lower abdomen, or it may arises from the anterior division in the front of thigh. Otherwise, the most consistent branch from the anterior division is nerve to sartorius. Apart from that, the anterior division gives two cutaneous branches. One is known as medial cutaneous, another is known as intermediate cutaneous. So there are two nerves which are supplying the skin of the front of thigh. One is medial and another is intermediate cutaneous nerve of thigh. So we have three cutaneous nerves in the thigh. One is known as lateral cutaneous, one is medial cutaneous, and one in between them is intermediate cutaneous. But my dear students, you have to keep this thing in mind that lateral cutaneous nerve of thigh is a direct branch of lumbar plexus, which I just explained in the initial part of this lecture, while intermediate and medial cutaneous nerve of thigh are the branches of anterior division of femoral nerve. Now when you will go to the posterior division give again the branches to the muscle, to the skin. But along with that, posterior division also gives the branches to the joints. So what are the muscles supplied by posterior division? Posterior division is mainly supply the quadriceps femoris. You know that quadriceps is a very bulky muscle of the front of thigh, and quadriceps is having four components: rectus femoris, vastus lateralis, medialis and intermedialis. So all the four components of your quadriceps supplied by the posterior division of femoral nerve. But my dear students, there is one more muscle in the front of thigh which is known as articularis genu, and this articularis genu is also supplied by the posterior division through the branch to vastus intermedius. Now this is a question which has been asked so many times in your exam. So when you are talking about the front of thigh, you are having the sartorius and quadriceps. Sartorius is supplied by anterior division and quadriceps supplied by posterior division. Now what will happen, this posterior division also give a cutaneous branch which is a long cutaneous branch, and this long cutaneous branch is known as saphenous nerve. What is that? Saphenous nerve. Now this saphenous nerve is a long sensory nerve, and it supplies medial aspect of knee joint, medial side of your leg and medial side of your foot. Now my dear students, please keep in mind that saphenous nerve does not supply the skin in thigh. For the thigh, we are having the intermediate and medial cutaneous nerves and lateral cutaneous nerves. It is not supplying in the thigh, it is supplying the medial side of the knee joint, medial side of your leg and medial side of your foot. Clear? So please keep this thing in mind that saphenous nerve, though it arises in the thigh, but it will not supply in the thigh. It will go in the medial side of the area below the knee joint. Clear? So here, if you will see, now this is your saphenous nerve, and this saphenous nerve is going down from this point. So here, this is the area from where the saphenous nerve will start to supply, and it will go down and it will supply this whole skin of your medial aspect. Now there are third set of the branches from the posterior division. As I already told you, it supplies the joints, so it supplies hip joint and knee joint. For the hip joint, you will have nerve to rectus femoris, and for the hip joint, you will have nerve to rectus femoris, and all the nerves to the vasti also supply the knee joint. So now, sometimes you have this question that name the branches of femoral nerve which traverse the adductor canal. You know that this is your femoral triangle, and when you will see on the apex of femoral triangle continue with the adductor canal. So there are two nerves of the femoral nerve which are passing through this adductor canal. One is saphenous nerve and second is nerve to vastus medialis. But my dear students, the saphenous nerve, we know that through the adductor canal, structures passes from front of thigh into the popliteal fossa. But this saphenous nerve does not go posteriorly. It will enter and from this upper part of the your adductor canal, it pierces and comes out on the medial side. So please keep this thing in mind that these two structures, though they are passing into the adductor canal, but they are not going into the popliteal fossa. Clear? So, in nutshell, which structures supplied by femoral nerve? So, in nutshell, which muscle supplied by the femoral nerve? One is the iliacus, then pectineus, then sartorius, then all the four part of your quadriceps femoris and articularis genu. Then which part of the skin supplied by femoral nerve? So it divide and it supply the anterior and medial surface of the thigh by the medial and intermediate cutaneous nerve, plus it will give a saphenous nerve, and I told you that saphenous nerve does not supply in the thigh, but it supply the medial side of the knee joint, ankle and leg along with the medial side of foot. Clear? And lastly, the nerve will also supply two joint, one is hip joint and another is knee joint. So now what are the important clinical points of this nerve? So first is your femoral nerve injury. So if there is a stab wound or if there is any wound into the groin, what will happen? There is a paralysis of quadriceps along with the sensory loss on the areas which are supplied by the femoral nerve. So where is the wound? Now if you will have the wound here in the upper part of the femoral triangle just below the inguinal ligament, it may affect the femoral nerve. Then we will give the femoral nerve block. Femoral nerve block, that means to produce the local anesthesia. So injection are given around the femoral nerve. Second is adductor canal block. Now adductor canal block, as I already told you, that saphenous nerve passes through the adductor canal. So at the upper part of adductor canal, if we are injecting the local anesthetic agent, we are not blocking the whole femoral nerve, we are blocking only the area supplied by saphenous nerve. So this is a question which has been asked so many times, that adductor canal block blocks the whole area or supplied by femoral nerve? No. This block only helpful to block the areas which are supplied by saphenous nerve. Then you have the adductor canal compression syndrome. Now sometimes what will happen, that in the canal there is a hypertrophy of the muscles, and once there is a hypertrophy of the muscles occur inside the canal, what will happen? It causes the compression of the neurovascular bundles which are passing through the canal. So again, if there is a compression of the saphenous nerve will occur, what will happen? There is a neurological problem which is known as claudication. So patient is having abnormal sensations, patient will have the numbness, patient may have the other neurological symptoms related to the saphenous nerve only. Or because in the adductor canal you are also having the blood vessels, so patient may have the compression of artery also. But because today we are discussing the femoral nerve, so if you are talking about adductor canal and relation with the femoral nerve, always keep in mind that most of the time we are dealing with the saphenous nerve. So if you are putting anesthetic agent in the adductor canal, we are actually sensitizing with the area of your saphenous nerve. Clear? In the same way, if there is a compression in the adductor canal, which part of the femoral nerve will get affected? Another, it is again is the saphenous nerve compression. Patellar tendon reflex. You know that patellar tendon reflex is a deep reflex, and this is also known as knee jerk. And this knee jerk or the patellar tendon reflex is again we used to do to identify the lesion in second L2, L3, L4 segments of spinal cord. And we know that L2, L3, L4 segments of spinal cord give rise to the lumbar plexus, and we are dealing with the femoral nerve. So the patellar tendon reflex is also important to assess the femoral nerve. Clear? So now at the end of this session of the femoral nerve, I hope now you are able to understand the origin, what is the difference between the origin of obturator nerve and the femoral nerve. Then I already discussed about the course of the femoral nerve, the branches of the femoral nerve, area supplied by the femoral nerve, and we have seen the area supplied by particularly the saphenous nerve in detail. So this is all for the session. Thank you.